All right, thank you for staying with Daybreak. We're talking about the COVID-19 in the school calendar. CS for Education, Professor George Magoha says schools will reopen as always because according to him, there's a likelihood that the viral curve will go lower. We'll find out what happens from the medical team. We'd also like to hear from you. What would it take to ensure that you're comfortable sending back your children back to school? At Trevor Mbija at Citizen TV Kenya, use the hashtag Daybreak. Let me introduce my guest real quick. Honorable Janet Muthoni Ouko is here. She's the CEC for Education in Nairobi County. Honorable Wilson Sosion is also here, nominated Member of Parliament and NAT Secretary General. Thank you so much for making time. Sami Ndungu is also here, head of Sanofi Pasture, Eastern Africa. He's a medical biotechnologist. And also Peter Ndoro, the CEO for Private Schools Association, will be joining us online in just a bit. Ndungu, I'll start with you because we've known now that Rwanda is thinking of having vaccines here in Africa. What would it take for Kenya to produce vaccines?
Thank you very much, Trevor, for having me. Actually, vaccine development is just not a one-step process. It's not a one-step process. And what perhaps may not be known is that today Kenyan scientists and Kenyan institutions already play a huge role in the development of what we get to use as vaccines. Numerous vaccines go through various processes, both what we call preclinical, meaning that they are tested before in non-human subjects, before they go into primates and then finally to humans. And phase 1, phase 2, and phase 3 clinical trials on vaccines have been happening in Kenya for many, many years. What is not there today is industrial scale production of vaccines.
Okay. That
is just what is lacking today. The platform that can be able to mass produce vaccines is where we are not today.
So it's not the knowledge, it's a lack of capacity.
For now, yes, the industrial scale production of vaccines is what we do not have in Kenya. Yeah. But otherwise, we have great collaborations with different research organizations and pharmaceutical companies that produce vaccines.
But is it possible to scale this up? Because if Rwanda is thinking about it, what do they have that we don't?
I would say this, and this is now my very personal opinion. It's at the time I went to school, actually, Kenyatta University, with tremendous respect to Honorable Sosion, was only training teachers. Yeah. Today we have a big research and research facility and hospital doing all sorts of diagnostics and treatments. Yeah. It is possible. Okay. It's possible to have an industrial scale production of vaccines locally.
Okay. All right. Honorable Sosion, do you know, Magoha mentioned that the school calendar remains the same. Are the teachers ready? Do you think we've done enough to ensure that they're ready to go?
Considering the first lockdown of 2020, which took 10 months, and the experiences drawn from that period, yeah, we think this time round there is no reason for schools reopening to be postponed, even if the positivity rate is high. Government should, as a priority, prepare to ensure that students and teachers report safely back to school as was scheduled. And if the positivity rate will still be high, then we should find other ways of mitigating the disease without closing schools. Yeah. I think we are clear about this. Looking at the side effects of gender-related violence activities meted on girls at a very high scale, drug involvement by students, we don't think we can let students stay out again with the excuse of the pandemic. And I think this is what the global community has done. They've ensured that schools should be able to open and function, yeah, despite the varying scales of the pandemic. So from our domestic viewpoint as teachers, schools, there is no reason whatsoever why in-person learning should not resume, yeah, as scheduled, because, yeah, already the calendar was disrupted. We cannot disrupt it any further. We would only be urging the government to ensure that the vaccine rollout for teachers and education personnel is escalated, because as we are speaking now, the number of teachers who have been vaccinated are close to 70,000, but we are talking about 500,000 teachers there is need to strengthen and upscale the campaign for the uptake of the vaccine of the education personnel.
Yeah.
Once that is done, then we would always be very sure of reopening schools safely, conducting learning safely, because we must learn to create an equilibrium with this disease and negotiate with the disease and go on with normal learning. It would be very unwise for the country to postpone reopening of schools. So schools must reopen.
Okay.
Yeah.
Janet, do you agree?
Yeah, absolutely. I really don't think there is any other option that we have on the table. And the only thing that, I mean, it's only obvious that schools will resume in May. Yeah. Because by the time schools were opening, you know, after the long, shutdown, I remember parents were worried, and, you know, everyone else was. We didn't know how things would turn out. But really looking at how we have gone through and children have closed, KCP has happened, and now KCSE is ongoing, I think it's only fair for us to say that we have managed as a country. There might have been many challenges. I was just going through texts from a lot of parents, especially by the time schools were reopening after the long shutdown. And parents were saying by the time they took their children to school, they were shoulder to shoulder, you know, despite, all this 1 meter, 1.5 meter, safe distance thing. Parents were saying, no, we are putting our children in the bus, there is distance in the bus, it is costing us, but when we get to the class, the congestion. But I really would want to maybe say that there's another explanation outside that, but the thing is, and what science is telling us about this is that really children are not at a very bad place. Yeah. So keeping them home would be so much disastrous, because as it is now, when the pandemic began, it was a health crisis. But you see now we've sort of managed to go through the health issues, and now we are staring at an academic crisis, which probably we will talk a lot more about in terms of what learning opportunities have we lost. You know, is learning actually transacting? Because by the time a child is getting to the class, we have got worried teachers, as Honorable Sosioni is saying. Yeah. And I really want to say that it's been really sad, because we've lost quite a number of teachers. I don't know if Sosioni has got the data. So there is a school and learning situation that needs to be managed. There is a lot of assurances that need to happen. Probably the learners are safe, but how about their caregivers? How about the teachers? What assurances is going on there? And I think it's really very good to see that the government prioritized the vaccination of the teachers. And so we are looking at probably by the time schools opened, we really hope that all the teachers will be vaccinated and all of them are going to get an opportunity at their second jab, because it's really very important that we protect these soldiers that have been with our children. Even when everybody thought that it was not safe, our teachers really sacrificed. Even those that were told to stay at home, there are those who said, the only place that I know that I can get, I feel good and safe to go is school. So a lot of them made sacrifices. And really, in May, we have a lot of lessons that we have learned. So the only thing is for us to now build on that, improve. There's some things that we didn't do right. So now maybe looking at how do we ensure that, because a mask has really proved to be a life changer and a game changer. So how can we make sure that every child is masked up, every teacher, every caregiver that is going to school is masked up? And how do we do campaigns to make sure that a mask is not a school thing? Because a lot of children will have put the mask in school because mwalimu atanichapa, ama mwalimu, in school there's a lot of discipline. But when you get out of the school compound, then you drop it and you just go about your other businesses as you. And the other question is, and I don't know whether there are medics or some experts in the house that would probably answer us, there's this thing that is going around that children are probably the carriers. I don't know. So that them, they're so fine, they're okay. But when they came home, there's something that happened. We could see a lot of spikes and a lot of things going up. So I think there's still a discussion that needs to happen around that area.
Ndungu, is that necessarily true? And how then do we deal with this issue of vaccine apathy? We are seeing a lot of stories of blood clots here, blood clots there. Some people are saying people just don't want to take vaccines. Is this a normal occurrence, vaccine apathy, and what is the best way of dealing with it?
There are several things that we can look at. Vaccine apathy really is not new. From the 1760s, the days of Edward Jenner, we always had people who doubted that you could inoculate something that would prevent you from getting a disease. But it's also true that from a very long time, human beings felt that there is a way you would prepare yourself for an impending infection.
Yeah.
Having said that, vaccines save lives. There are very many diseases that we probably do not know that have absolutely no cure. In the years gone by, measles used to wipe entire families. We don't have treatment for measles. The only reason we've pulled back on measles, more than 95% of the cases, is thanks to immunization. Why we do not have people suffering from acute flaccid paralysis from polio is not because there is treatment. It's just because the vaccine has been effective in rolling back 99% of all polios. Yeah. Louis Pasteur, now that I work for Sanofi Pasteur, died 130 years ago in 1895. Rabies was 100% fatal if you didn't get a vaccine. 130 years later, rabies remains 100% fatal unless you get a vaccine. There is no treatment. That then makes it very clear that our only way out of this pandemic, of course, we will observe all the other protocols as we wait for our time at the queue to get the vaccine, is the vaccine. Okay. Vaccines save lives. And indeed, if you are to look at, since you talked about the side effects, possible side effects, the most comprehensive data I've seen of possible, because it's still early days of connection with clots, is 4 in a million now. 4 in a million compared to 1,763 clots from smoking. 165,000 per million from COVID, the disease. We're talking about possible 4 against confirmed 165,000 cases of clots per million for people who suffer from COVID disease. Okay. I think I saw the Minister of Health in the UK saying that the risk is no more than that one of taking a 200-mile journey by bus, 400 kilometers by bus. The risk is no different.
Okay. And is it true then that children handle COVID better than adults?
It's a mystery. Yeah. It's a mystery. I went to school at the time, and I'm sure Dr. Janet here and even Sosion, we learned in school that the burden of disease predominantly would be heaviest on children under 5. We are living a new age where we have a disease that seems to be selecting you based on your age as you age. It's a mystery, and to date there is no evidence so far that either children are playing a role in the transmission and therefore infecting the others, not for COVID, and there is no such evidence today. Yeah. Indeed, I have seen also the Minister of Education in Kenya saying that children are safer in school, and it seems to be true, actually. Okay. One term later, that appears to be true. Okay.
Honorable Sosion, how do we deal with this issue of children? Because I think, have we learned any lessons, or do we just maintain the same graph? And Janet was talking about it. The children go in, they have masks. Before you know it, they're hugging, they're giving each other masks, they're sharing the masks themselves, including with the teachers. So
now, during the first
style of learning, because teachers are used to having almost like a very close relation with the children. Now, this is a situation where they try to keep them at a distance. It's not normal for the children and for the teachers themselves as well.
You know, teaching pedagogy and learning all through, and that's why it's called a school, because the young learners group together. That's really one of the, one characteristic that is very difficult to eliminate in a learning setup and in a classroom. And initially, during the first lockdown, when these restriction measures were introduced globally, there was outcry by teachers all over the world that it is difficult to maintain certain protocol like social distance for learners, and therefore it has not been a very, very easy undertaking in school. Nevertheless, the aspects of masking, I think, has been the most effective, and That is one area of investment which authorities all over the world were encouraged to do. That is, it's indeed far much easier to mask children than to force them to show social distance.
Yeah.
It may not be possible really to do that, but protective devices using the mask really was found to be the best. And teachers initially were so constrained to try and implement some of these measures, which really was difficult to implement. Yeah. And when we were reopening schools here in Kenya, there was a strong argument about social distancing. Are we going to implement? And everybody was mad that we should social distance. We should build more classrooms. We should even conduct teaching outside the classroom. But we agreed, let's have children back to school and ensure that they have masks. And as much as possible, we implement what we could implement. Yeah. And so far down the line, indeed, we've succeeded. As Dr. is saying, children are safer in schools. And this is a study we carried out in Africa. And I think right now, we should now think about safe schooling in the entire continent of Africa when we talk about vaccines being upscaled. Yeah. And the only measure is a vaccine. I think we should focus in the area of investment of vaccine rollout. Looking at it today, the uptake of the vaccine in this country is at 500,000. Yeah. And looking at the statistics and projections of government by 2023, the vaccines uptake will be at 16 million Kenyans. And the conversation of vaccines being produced in Africa, I think, is a brilliant idea. We should not over-rely on donations and from the north. We should now be able to domesticate this so that then the safety of everybody in school will be massive vaccination. Is government willing so that we don't over-concentrate on for how long are we going to live with these restrictions and lockdowns and all this? No, we should open up our lives, open up the economy, and the master card of ensuring that all this goes on is the vaccine. So fundamentally in schools, we'll continue implementing these protocols the best way we can. And we encourage learners, even away from schools, it is safer to be in a mask, even when they are with their parents. Now there's a new pedagogy. We've got to teach life skills, these learners again in school, and how to go about and how to manage, to understand COVID and how to manage COVID, even when they're at home. So really, there's a new way of life of dealing with this. And even as we do that, then looking at the trend of the disease in this country, sometimes it goes up, and we've had a positivity rate of up to 26%. That tells us that community effect. Yeah. And of course, the number of deaths are so high right across, including even our members. We are receiving data, at least every day, we have a teacher or two dying out of COVID. And this is a real situation. Yeah. So then, moving forward, for us, can the government massively roll out the vaccination of citizens? Okay. We should not be told of 16 million Kenyans by 2023, while we are 50 million. How many will have died? Okay. So really, there must be a master plan within the country and a master plan within the African region. Okay. It's very inspiring to see Rwanda thinking of producing vaccines. We've seen South Africa talking of producing over 200 million doses of vaccines. That means it will cover South Africans and the rest of the continent. So really, within the context of education, let's look at massive vaccination to ensure that schools reopen and function peacefully and smoothly all over the continent of Africa. We should not even look at it locally. We should look at it within the context of Africa. Okay.
Let me bring in Peter Ndoro on this. Peter Ndoro is the CEO for Private Schools Association. He's joining us online. Peter, before you joined in, we were talking about, are we ready to reopen schools on the 10th of May, like the CS Magoha said? From where you stand, is it possible? Are we ready for that?
Thank you very much, Trevor, for having me this morning. And I want to join my colleagues on the panel to say that, yes, indeed, we are ready for reopening on 10th of May, as pronounced by the Cabinet Secretary. Remember, when we closed our schools on the 10th or on the 19th of March. We closed very well, knowing that we are going for the second term break. And within that period, we had started seeing some spikes in terms of infection and all that. And the government came in and brought in some new restrictions. For us in the private sector, basic education, we want to believe that so far the citizens of this country are obeying the restrictions that have been given. And as a result, we are going to see a decrease in the infection rate. And that will allow us to be able to reopen on the 10th of May. If we are not going to reopen on the 10th of May, we are going to fundamentally and negatively affect the completion of the recovery process of the curriculum as we had planned in for 2022. So at the moment, we in the private sector are ready to reopen as pronounced by the Cabinet Secretary on 10th of May.
Yeah, but for the longest time we were complaining about having structures, building the structures. Should we now slow down on that? Because the biggest concern was always, where are they going to learn? We need to build more classrooms. What should we do at this point?
You know, the challenge that we've had in the basic education sector basically is not about increasing the infrastructure, but how can we ensure that the children within the school environment are able to obey the protocol that have been given to them by the Ministry of Health and the Ministry of Education. One of the things that we need to ensure and continuously insist in our schools is that children should be able to unmask properly. Children should be able to wash hands with soap and regularly so. We should be able to capacity build our children on issues about COVID and why they need to mask, why they need to hand wash, and also what they need to do to also influence whatever happens in their homes so that we reduce the infection rate. If we are to talk about maintaining a social distance of 1.5 in our institutions, believe you me, it will take us very many years for us to reopen. At the moment, it's not even possible, as Osun has said, for us to force children to social distance. It might not work because these are children and the children will always be children. So at the moment is for us to adhere and ensure that those basic protocols as given to us by the Ministry of Education in as far as hand washing, masking, and continuous education is provided in our education institutions. Putting up infrastructure may not be able to work because we may put up infrastructure, yes, but at the end of the day, children may not be able to social distance. But if we keep on insisting that, yes, you must hand wash, you must mask, then we are going to achieve that.
Okay. Janet, you know, you and I had a long discussion about this before the schools were reopened during the 10-month break. What have we learned so far now after the reopening? Where should we prioritize?
Yeah, I think for me, and I've moved beyond COVID because really a lot of people, a lot of experts are really taking care of that. But in the education sector, and especially those of us that are occupying positions where we're able to influence policy and make decisions that really affect the children. One thing came out that we have not been properly investing in education and expanding, you know, the infrastructure at school. This could easily be picked when the minister called for reopening, and you could hear parents really criticizing and saying that these are the kinds of classrooms that we have. How do you expect us to, you know, and also looking at the whole component of WASH, you know, the sanitation and hygiene, and how really, plainly speaking, that component had totally been neglected, so that you walk into a school, there is no water supply, not that there is no water in the neighborhood. Yeah. The neighboring plot is having water, but it is almost not considered as important to have water in the school. And so a lot of those things have now come to the fore, and it has really opened, you know, the eyes of everybody, including the parents, that really water is very important. And I want to say that from where I sit, we have connected a lot of schools now to water. So I think as a result of COVID, a lot of schools now in Nairobi are going to be having water. There are so many boreholes that have been sunk in Nairobi just to make sure that households have got water. Yeah. And I think the rollout of infrastructure, I've gone to several constituencies and I've seen that members of parliament have really invested in developing infrastructure, because I think when COVID came, we were so exposed and the sector sort of looked naked. I can tell you in Nairobi, for example, we have only 205 public primary schools. and they are full. Like, as in, you can't even recommend that a parent take your child to Jehovah Jireh Primary School because the classrooms are bursting. The government, the county government of Nairobi has not been making investments towards expanding. There is no brand new school that has been ever built in Nairobi for the last, I think, 10 years or so. So those are some of the things that were exposed. If you think about Nairobi, you have about 10 wards that don't have even one public primary school. Now COVID came, and as Ndoro would bear as witness, a lot of these small and alternative providers of basic education have shut down, and they will not even open. And in fact, the third wave has even exaggerated things, so that those that were trying to manage, and then now this shutdown came, because as much as schools will open in May, and maybe schools will not be affected, we're looking at the households that now have been affected by the collapse of businesses now, so that a lot of parents might not be able to take their children to private providers of basic education. In ECD subsector, for example, where I lead, we received 30,000 children by the time we opened our schools. And we had to, even in some places, we had to put tents outside, because now children have come. You can't really tell them, go back home. You just want to provide a place for them to really play, to hang on the swings and so on. So I think COVID really exposed, the responsibility of government, so that government should never sit pretty thinking that the private sector, for example, can insure, the children. So that when the private sector collapsed, every parent knows that government, I will just go back to a government establishment because there my child is entitled to free publicly funded education. So I think there's something that should happen in government, where really now squarely take up the responsibility, and let's begin to look at our indicators. What indicators are we looking at? Every year, we are expecting more children to come back to the schools. What expansion are you doing? Have you expanded your facilities to take care of probably, say 100,000 children that are going to come back to you? So sort of looking at it from a results perspective, and not the usual. That government, we have opened schools, we have done this. What exactly is and I think these discussions are only fair, to have. So that we really don't insist in data. It's something that I really find not very nice, because what in this whole discussion, it's sort of we are discussing in a hollow, but we need to know what are the effects of COVID on our education sector. We begin here, that XYZ number of children came back to us, in the public schools. I remember even the Cabinet Secretary for Education giving a directive that no child should be barred from accessing, because where I was learning, maybe I was in Nairobi, households, source of income collapse. We went back to the village, but I am not able to access that school because I am told that the school is, there is no vacancy in the school. So I think COVID, now I would really like the health now department to be separated from these other subsectors, and let the education subsector really take its business up. What are the effects of COVID? How are we dealing with COVID, and what have we learned, and how are we adjusting ourselves? Because today is COVID. Tomorrow it might be something else. Might be something different. Are we going to sit at the same place we sat when we were discussing COVID, despite all the lessons that we have learned from that?
And Dungu, let's delve into that in a bit. You've been dealing with vaccines for a while. What is your assessment of how we've handled this COVID-19 vaccine, and what should we have done better?
Okay. One, I think everyone who was prioritized to get immunized should have rushed to go get immunized. That's really, in my opinion, we shouldn't be saying that the vaccine will run out in 10 days. People should have gone to get immunized for these past 4 weeks. As Honorable Sosion has insisted and emphasized, our only way out of this is for people to get immunized. It goes beyond health. It goes into education. It goes into the economy. People will get back their livelihoods. People will get back their jobs only if we are able to control the pandemic. And we have the other tools. We have the other protocols to keep us safe until such a time that majority of Kenyans get immunized, because that is the only way out. So I think people should go get immunized, and then we will get replenishment. I can also say for a fact that global vaccine production is increasing without a doubt. As we go along, more and more vaccines will become available. And so Of course, there is wisdom in the priority list that has been set, because if we are looking at the teachers who will interact with plenty of students, they obviously are, in most of the cases, a lot more elderly than the children they teach, for the most part. And we've already said that this is a disease that is more and more severe with age. So it is important that these teachers should all get immunized. Now, the elderly, when we get to immunize the elderly, we save them from the severest of the outcomes from COVID. You know, severe disease, having to be in ICU, and even possible death. And then the healthcare providers, we not only keep them safe to continue taking care of the rest of us, but we also disrupt transmission so that then there is no possibility of a healthcare provider who may be asymptomatic transmitting it to the patients that they are seeing. By looking at that priority list, if everyone on that list would go no later than today to get immunized, we will already have taken very giant steps in rolling back this pandemic, and just how much it gets to ravage us.
Should we have done the messaging differently? How best to deal with messaging? Because I know you've been dealing with vaccines for a while. This is one vaccine that has so many things coming through. How should we change that messaging so that the perception towards the vaccine changes? We bring in Sputnik 5, we stop it. Now Johnson & Johnson, we've stopped in the US, stopped in the South Africa. These are facts, but at the same time now people are thinking, Mimi, I'll just wait and see what happens.
I think we should do our best to look at everything in context. That any steps that are being taken is just to continuously ensure and safeguard the safety of the public, to ensure the safety of the people. The fact that the US authorities have said that they will stop giving the Johnson & Johnson vaccine just for a moment to reevaluate what has happened is not in itself a bad thing. It's actually a good thing. And I think this should give everyone who is a consumer of vaccines confidence that care is being taken to ensure that vaccine safety is paramount. And when we do resume vaccination with the vaccines, I think it is also important for everyone to see this in context. That yes, we step back, had a look at what is it that we are seeing, and does it alter our view of the fact that the use of this vaccine is an important thing. I think we always look at the part that it has stopped. We don't look at the part that comes back after evaluation, that look, the benefits of vaccination by very, very far outweigh any potential risks from that vaccination.
All right.
I think the problem here is the communication, as you're saying, Trevor. Because look, this to me is seeming like a powerhouse, you know, in terms of, you know, the technical groundedness of vaccines issues. So how many people would probably be looking at it like that? You know, what we pick is somebody picks a tweet from where it was and he says this, and that's what now circulates to us. And so I think if there was somebody with this kind of an understanding, but then now, you know, tones down the message and really very quickly sends out messages that, yes, this is what is happening, but it is for this and this benefit, you know, that way, because I think the communication has not been, you know, forthcoming. So people are led to go with what they're seeing on social media. You know, I remember when, you know, my friend Honorable Johnny passed on, it was just a blanket statement that it was because of the COVID vaccine. And you see, really, no effort comes out to really clarify, you know, how are things, so that a lot of miscommunication is out there, and probably that could be why the uptake is not, you know, as vigorous as somebody would expect. And I'm really sitting here with him, and I'm hearing, you know, how he's enthusiastic that if everybody who is lined up to take the vaccine could take it today, or at worst tomorrow, and I'm wondering, wow, do we have as enthusiastic people? And you know, when they are not enthusiastic, it affects us. It affects me. You know, it affects your neighbor, because this is how COVID, you know, behaves. So it's our responsibility to really carry out communication to the effect that everybody would really think as collectively that your vaccination really protects me, it protects everybody else, and it is good for all of us.
And so, what do the teachers, kind of support do they require now? You said, yes, the vaccination. We're talking about 70,000 teachers out of 500,000. In the country itself, we've just inoculated more than about 525,000. What kind of support in terms of welfare do the teachers need at this point?
Yeah, looking at the statistics of 70,000 teachers having been vaccinated, and the key issue here is protection. I think health protection. Yeah. Comparing, for example, with the medical personnel, in this country, over 100,000 of our medical personnel have been vaccinated. And the medical personnel by population is not so large, meaning the response from the medics in terms of vaccine uptake has been very, very high. Now, here the frontline officers were expected to take the frontline to work in the learning institutions. And the uptake is so low, is at 70,000. This should worry the country. It should worry the Minister of Education. It should worry TSC and all of us. And I think that is an area that needs to be focused on as we prepare for reopening, to urge teachers to take up the vaccination. And I don't think any of them has been restricted. And when these figures came out about a week ago, it was 35,000. And after 1 week, the data rose to 70,000 out of 500,000. That brings us to the issue of demonizing vaccines. Mm-hmm. The vaccines were demonized at the very beginning, that there are side effects, there are blood clots, it can trigger the virus itself, and you die. You know, there have been a lot of narratives. And Kenya, in terms of social media and blogging and passing negative information, is so virulent, like a virus itself. And so I think teachers, and here I'm urging teachers within the country, the uptake is so low. Can you upscale the uptake of the vaccine? You will be a dangerous person as a teacher if you go back to school in the month of May if you have not been vaccinated. Yeah. It is good. Let us lead by example. The side effects notwithstanding, I think it is patriotic enough for us to take up these vaccines. Those who have not been vaccinated, visit the nearest health facility and take take your first dose of vaccination. It is important as teachers that we lead from the front. We have seen our political leaders, because some of them were hesitant. The rollout went on for a while, and we started seeing now leaders coming forward and getting vaccinated publicly. We must remove this stigma of demonizing this vaccine. We are better off taking the vaccine than waiting to die. Okay. And therefore, the road of confidence of reopening schools in the month of May, and because we gave this position even as a union when these restriction measures were pronounced by the president, that it will not be necessary to prepare for prolonged closure, because now the vaccine is here, and the most risky personnel, the teachers and workers. What reasons really do we have for teachers and workers not to take the vaccines? They must be vaccinated. It is important for their health first as individuals, because we've seen the last couple of days teachers dying out of COVID. And I want to believe if when the vaccine arrived in the country and most of them took up the vaccine, they probably would not have lost their lives. We are not ready to lose the life of any teacher. Okay. We've got a very comprehensive medical network to protect teachers. Now that the vaccine is here, really it will be the biggest mistake for anybody to lose life because of not vaccination. And it is now time. The frontline officers, the medical personnel, teachers, mobilize members of their families and people close to them to take up vaccination. I think the business we should have is to mobilize people to take up the vaccine, even if the doses currently available in the country may not cover the entire population. So that then, as the progress of global production of vaccines and even domestication, you know, to look at a country like Rwanda, thinking and imagining of producing vaccines locally was an eye-opener. And Kenya being a country that has produced vaccines, particularly in the veterinary world, then it's possible also as a regional economic hub to really produce also vaccines.
Okay.
And so my take is teachers should be vaccinated, all of them.
Okay.
All of them.
All right.
Before we reopen schools.
All right.
And it's up to them to take the initiative.
Okay.
Because the vaccines are within reach.
Yeah.
So I urge all teachers, please, the best welfare action that you can take for yourselves and your families is to go for the vaccination.
Yeah, Ndoro, what is, in the circles where you are, the Private Schools Association, what are the teachers saying? Why is the uptake so low?
Initially, when we started in the private sector, there was very little understanding about the benefits of the vaccine and the dangers that were circulating in social media. And we saw quite a number of our members of staff being reluctant in taking up the vaccines. But at the moment, we have seen enhanced interest because of the continuous education that the Kenya Private Schools Association has carried out in terms of the benefits of the vaccines, where we've told our teachers that you're getting vaccinated to save your life, to save others and the people that you love. And that campaign has seen a steady increase in the interest of teachers taking the vaccine. What I would want to urge our colleagues in the basic education sector is to continuously encourage everyone, not just teachers. We also have other non-teaching staff in our institutions to be prioritized and take up the vaccine, because this is the only way that we are going to sort out this pandemic. So for us in the private sector, at the moment, despite the fact that the uptake is still very low, but we are happy that it is increasing. And we can say that comfortably, that quite a majority of our teachers are now getting interested in getting the vaccines. So we would urge the government to continue providing these vaccines to everyone, and also ensure that we also extend that and cover all the other members of staff within our schools.
But no, private schools, some of them closed down and there was a support system from the government. How far is that and how many of them are coming back?
Trevor, in January, when we opened on the 4th of January, 343 private schools that are members of the Kenya Private Schools Association shut down completely. We had been promised by the government that they're going to give us a stimulus package of 7 billion. It is still something that we are still following up. The government, you know, at the moment we've been told that there is a serious challenge of financial cash flow, which we understand as the private sector, but we are hopeful that when the situation improves, that support will still come to the private sector. Because private schools, in essence, support the government in expanding access to quality education. And you cannot ignore that particular contribution. And therefore, as a sector, it needs to be supported. And I also want to hasten that the kind of support that the private sector has been asking the government to give them is not free money. It is a very subsidized, low-interest credit facility that will assist the private sector to stabilize and continue with their role of expanding access to quality education. And we appreciate the fact that very many within the education sector space have appreciated that fact, that we need to support private sector as businesses that have employed very many Kenyans. Because when you look at the private schools at the moment, we have employed over 158,000 teachers and about 146,000 non-teaching staff. That is direct employment. You cannot, when you look at the indirect employment, it is just so much. So what we are saying is that, yes, we should continue considering supporting the private schools so that they continue supporting the government, especially at this time, at this point in time when we're having this particular pandemic. When we talk about trying to provide enough space, the government cannot be able to build and expand the facility they have. But in partnership with the private sector, that is very possible. So I think it is important for all of us.
Okay. We seem to be having a challenge there with Ndoro. We'll go back to him. But Sosion, you are part of the legislature. There was a promise for 7 billion for 343 schools that have closed. What's going on?
Now, let me take you back to the experience of COVID. And this has been a global problem by governments through what we call public-private partnership, PPP, particularly in the social services. And many of us, particularly unions, we don't believe in that. Education remains a fundamental human right. It's a declaration of the UN. And therefore, it must be provided for free by the government. And it would be very sad in this country to see the shift of responsibility of education from the government to non-government actors. And that has been aptly captured by Janet, looking at expansion of schools in Nairobi. They've never been expanded. They've remained the same number of schools, the same old classrooms, and now the fact that there is no guarantee in the private actors that they've had to change their business strategies and kicked children out is actually a lesson enough. We've been campaigning for the support of quality public education so that we have quality schools, that even a minister can send a child to the nearest public schools, and there is a guarantee. And that is what many economies have done, like the global north. The global north, schools are schools, public schools are well protected. And therefore, the lesson of more investment in, I think to me, I will go for more investment and more directing of resources to public schools and expansion of schools infrastructure. And not just school infrastructure, quality school infrastructure, complete with running water. All schools should be complete with running water so that we create safe and clean learning environment. That's a lesson. Going into the future, it should form the strategic plan of the education sector. And now there is need to match the strategies of the devolved government and national government in the responsibilities of expanding schools infrastructure. I don't see any reason why in the city of Nairobi, the county government of Nairobi should not fully take over the schools infrastructure, regardless of whether ECD, basic education is basic in that sense. And we should open up to county governments. If we're talking of devolving 35% of the national resources to the counties, a huge chunk of it should go into building of schools infrastructure. And we have seen it through CDF. CDF has done a tremendous job. Now the lessons from COVID tells us that we should now get more funding from the county government. And we have seen governors who have deliberately directed funding to schools infrastructure beyond ECD, and really it does work. So then it's a lesson for us as a country that we now need to work on school infrastructure and even go beyond school infrastructure. Transport of learners to school. Should we still retain it with the parents that they have to organize for transport of learners and buy school buses? It is time county government develop a master plan of taking over the transport system of learners in schools. I think we should be ambitious as a country to think the best for our children, learning from this pandemic, and we reorient the education master plan so that we structure the establishment of quality school infrastructure so that we deliver quality education and even look at the master plan of transport. And I challenge Janet, can it come a time that in the city of Nairobi, you have a transport network for children, that children can walk out from their homes, even at the slums, and get into a safe transport system to schools? That we should be ambitious as a country, and we should think about the best for our country. And I think for me, if you ask me whether I should glorify the government directing resources to the private entities, I will say a big no. Direct resources to public schools, because that is a UN resolution. Education is a fundamental human right. And while I don't push away the private actors, they are free to invest their resources. But what government can avail should be directed to public education. And we want to see a more robust public education system, not only